This snake presented to my clinic from multiple swellings underneath the skin. I gave him hydromorphone and alfaxolone for sedation, and then used lidocaine to numb the skin before making my incision. If you listen closely, we have him hooked up to a device called a Doppler, which monitors the heart rate. Surprisingly, it didn't take much force to pop out these balls of tissue, which we later found out were granulomas. Although it may sound like cancer, a granuloma is actually when the body makes a sphere of chronic inflammatory cells and connective tissue, usually around an infectious agent such as bacteria or fungus. It's a little bit different from an abscess, which usually is an acute process that has a clear capsule with pus inside. With any granuloma in a reptile, we want to rule out mycobacteria, which we did by using a special acid-fast stain. With any abscess or granuloma, it's important to take a sample and send it out to a lab for testing. We call this a culture and sensitivity, where the lab not only grows the bacteria, but then tests it accordingly against different antibiotics depending on what it grows. Fortunately, we were able to send this one off to a lab called Moichor, which showed us it grew an anaerobic bacteria called Clostridium sordellii, which is typically susceptible to metronidazole, which we prescribe for the patient. If you haven't checked out Moichor and all the tests that they have to offer, I highly recommend looking into it, as we use them for many of our dog, cat, and exotic animal testing.